The modern facelift procedure is quite different than what it used to be back in the 80s and 90s. Back in the 80s and 90s, it was more of a two-dimensional pull or look. These days we know that it's a three-dimensional contour of the face and three-dimensional volume and fullness of the face that is more important than a two-dimensional pull. So a typical patient opting for facelift surgery is a patient who over the years have started to experience facial volume loss and sagging. And I spend a lot of time making sure to educate the patient about what should be achieved. A patient should not look like they have had a surgery done once the surgery has been done. Donna has been my patient for the last few years. Basically, we have done cosmetic injectable procedures for her, where she would get a little bit of anti-wrinkle injections, some revolumizing with fillers. She felt that she was getting facial sagging and her jawline was not as sharp and defined as it used to be when she was in her 30s.
I've been seeing Dr. Jadoon for about 2 years now, I guess, having fillers and a bit of Botox done. I started it when my son was getting married, and over the last 2 years I've just got more tired looking, and I wanted to get a longer lasting result this time. And I'm 52 and unfortunately I still feel 25, so I wanted to try and get something that makes me want to get out of bed of the morning and feel like my old self.
The procedure for Donna was done under mild twilight sedation. She was not given any general anesthesia because for mini facelift procedure you do not need general anesthesia. First we've done the marking. We show the patient what areas we are planning to lift or improve. The muscles, the platysma muscle creates bands as the person gets into their 40s and 50s, so we had to sort of tie that up and then lift this area and this area slightly, sort of to freshen up the lower face. Donna did not want to have a look that would tell her friends and family that she has had a facelift surgery, basically. So with that in mind, we have to make it look very, very nice and natural. The scar had to be minimum and hidden well in front of the ear and then behind the ear. So we opted for a post-tragal incision, which went through around her ear and then at the back. I'm expecting the recovery to be quite quick, and she should be back to work within a couple of days.
I would definitely recommend Dr. Jadoon to any of my friends. In fact, there's a line-up at the moment. They're all waiting until I have my surgery, but yes, I would, because I think he's just a great person and a lovely man to talk to. He always explains things well and you feel like you're on the same level as him when he's talking to you. And I've just got a lot of confidence in him and he makes me feel comfortable, so I'm happy to do whatever he thinks is the right thing for me.
If you're interested in a mini facelift procedure or neck lift procedure, what I would recommend is to come in for an obligation-free consult. We will discuss different options available, both surgical and non-surgical. We will then look at your budget. We will then look at your downtime, when you can have the procedure done, discuss the pros and cons, and then you can make a decision based upon all that information.